हेलो एवरीवन एंड गुड मॉर्निंग। आप सबका स्वागत है आज के सेशन में। लास्ट सेशन में हमने बुक वन के बारे में आपको बताया था डॉक्टर योगेश सहगल ने, जिसमें डॉक्टर सहगल की जर्नी बताई गई थी। कैसे मेथड फॉर्म हुआ था, कैसे उन्होंने यहाँ तक रीच किया था इस मेथड के बारे में। आज हम उसको जर्नी को आगे फर्दर कंटिन्यू करेंगे। आज आपको बताया जाएगा इसकी एप्लीकेबिलिटी के बारे में। जितना आप थोड़ा बहुत आप लोग जानते हैं जो इस मेथड को फॉलो कर रहे हैं, हम उसको और एक्सप्लेन करेंगे आपको अच्छे से डिटेल में इस मेथड के बारे में। इसको कैसे केस टेकिंग में अप्लाई किया जाता है, कैसे इसमें मेडिसिन सेलेक्ट की जाती है, कैसे पोटेंसी को बढ़ाया जाता है या चेंज किया जाता है। ये फर्दर चीजें आपको एक्सप्लेन की जाएगी आज के 1 आवर सेशन में। सो आई होप यू ऑल एंजॉय इट एंड फाइंड समथिंग लर्न न्यू। सो आई वेलकम डॉक्टर योगेश सहगल टू स्टार्ट टुडेज सेशन।
So, good morning, everyone, and let me start with some final and new points for today. As Dr. Vedant has mentioned, that last time I started with book number one, so that you should have a acquaintance with the exact idea of what Dr. Sehgal wanted to say, what was his idea about mental state. Presently, it's like more than 25 years I have completed in telling about Dr. Sagar's method all over the world. I have toured around. So there are, so many informations in my mind to share with you. But due to the paucity of the time, it's not possible always to give you the whole thing together like a bouquet. So today I thought that, okay, what are the finer points which I must tell because uh, some new um, students have started to join also these classes apart from the old one and the seniors. Like the main issue, the first issue, which is important tool for Sagal to practice Sagal method, and that is repertory. Always I start that this is one of the tool we have to use it more perfectly, more accurately. Like I was when I started to look into the repertories, in the new repertory, the word they have introduced ailment. Now, why I'm using this particular word ailment, because I see that it is now a very common phenomena in the case taking. Because I have recently see a group only, I don't participate much in the groups. I see that the word ailment has been using doctors have been using so oftenly. Maybe correctly, I have any idea. Ailment, the word ailment. But you- to to understand, the first thing is that the word ailment is in repertories, but it is not a chapter inclusive exclusive chapter ailment, which has been introduced later on. The ailment word has come later on in St. Barthel repertory. Like for example, we have a rubric. You can write on the paper. Is better so that we have the rubric embarrassment, ailment after. This is our original rubric from Kent. And apart from Kent, we have one medicine from Herring, one from Boger, and basically all are from Kent. In the new repertory, for example, I open for you. The rubric is given. If you put embarrassment, there are first we see that there are 11 medicine in embarrassment ailment after. The word rubric is embarrassment ailments after. And if you see, for example, I open now complete, then I put the word embarrassment. So first they have see ailment from aggravation, ailment from embarrassment. 292 medicines from 11, and the rubric is embarrassment ailment from. And what I told you, which was rubric in Kent repertory, it is the rubric actually embarrassment ailment after. Maybe the newcomers who have started to use the repertory, they have no idea that even embarrassment ailment after and embarrassment ailment from embarrassment, or from and after, what is the difference? So if we read rubric ailment from embarrassment, then the first part is embarrassment and the second part is ailment. But if we use embarrassment after ailment, then the ailment will be the first part and embarrassment will be the second part. Now it means that embarrassment after ailment. So first the patient, for example, we are using this rubric exactly like embarrassment after ailment, but not ailment from embarrassment. It means that in the second part, ailment is coming from embarrassment, but we want to read the rubric like ailment, embarrassment is coming from ailment. Are you getting my point, everybody? Yes or no? You can raise your hand. Yes
Yes,
or
sir.
no.
Yes, sir.
Okay. So Dr. Kesh is there. You know us very well. What we want to say that Dr. Sagar, we already that we applied this rubric many a times, and we are always differentiating the medicine, 11 medicine, whenever a patient is coming to us, and this is very easy task for us. And it is so embarrassing that first the rubric has been changed, and second embarrassment is 292 medicines are been added. Is it possible to use this rubric with 292 medicine, or is it possible to use this medicine from 11 medicines? I
Easy
think
to
it's
use
better to.
11 medicines. Yes.
Yes, 292 means you feel so embarrassed, you leave it. You will not use it. Now, it means that the exact rubric, according to Dr. Kent, the first thing, for example, a patient comes to you and he say, Doctor, I have cough, I have sneezing, I have one problem, any problem, A, B, C, D, I have ailment. Okay, I'm not going to now distinguish between ailment, illness, and sickness. It's another chapter. So I don't think whether the people, doctors, fully understand the difference between ailment and illness, because sometimes I see in the groups that they use the word very very lightly. Ailment, ailment. Everybody is using the word ailment. Why not illness? I mean, if I never heard my patient has come to me and say, Doctor, I have an ailment. So if the patient is not saying ailment, then why I'm using it? If any patient has come to us say, Doctor, I have illness, I have ailment, or I have sickness, they just say that I have a problem. And what we are doing, we are decoding the patient's common word, problem. Sir, I have sneezing. And we are putting ourselves ailment, illness, sickness as we like it. So the ailment word, according to me, is like been used without its distinguish between ailment and illness. Now this. Now what happened that you when I asked the patient that you have a problem of a problem for last 2 months. If you have come to me for the same problem, you want to get better after 2 months, why? For example, patient says, I have a problem for the last 2 months. I did not care about it. I have a little bit cough, I was coughing, and then it subsided. Then it used to come back. Then it was like this. But now the coughing is becoming more louder and more painful. And it is associated now, it is coming with phlegm. It is associated with phlegm now. I have to spit the phlegm, which is very bad in taste and smell. Now, the cough is one problem, phlegm is another problem, which he has to bring it out with pain. And and for that reason, he said, Doctor, now when I was only having cough, like a disease, like an illness, I was not too worried about it. But later on, it has started to convert into more painful, more difficulties. I was not able to walk, not able to eat. These are the ailments. Now, because of that, for example, I'm in a meeting and somebody offer me something to eat, and I have to refuse it because I know that if I eat it, my cough will increase and then I have to spit more phlegm. And when I have to refuse, I feel very embarrassed. So slowly, slowly, Why this patient has come to us? Because of the embarrassment feeling, which is now associated because of this ailment, which is not leaving him. Because some symptoms they disappear, they come and disappear, but some symptoms they stay. For example, a patient says that that I have to get up in the meeting, or I have to excuse all the time in the meeting, or I have to excuse myself that I don't want to eat. So this is very embarrassing for me to stay in a party, to stay in a meeting, even in an office. Everybody looks at me when I come because they get scared. The word embarrassment is there. So the patient is coming to us for embarrassment. Patient is not coming to us because he has a problem of cough, sneezing, or any problem. Patient is coming to us only to homeopath that, okay, I was taking, doctor, now I have to take some syrups, I have to take some medication. In front, embarrassment is when you feel embarrassment in front of somebody, not alone. When you are alone, you are not feeling embarrassed. But when you are facing somebody in a situation when the cough becomes louder with noisy, for example, somebody is suffering from gastric problem. He passed the gas silently. There is no embarrassment, even if there is a smell. But when it is a fart, it is coming with noise, and then people are sitting there, then you feel concern. Oh, it's very noisy fart. I have to control it. When why this patient want that the fart should be controlled? Because if it happens in the public, then he feels embarrassed. So the signal coming from the mind for the patient is go to the doctor, take the medicine, and sought the help to remove the fart problem, because it's very embarrassing when it comes in public. Okay, are you getting my point now? So embarrassment is in this rubric, embarrassment, ailment after he passed the fart, then embarrassment comes. So in the patient mind, the signals are coming that he has a problem for which he is feeling embarrassment. Now my job is to understand from this 11 medicine which medicine I have to give. Okay. And now here I have to start asking few questions, because it happened that sometime, okay, that is the one part which we have to correct with every rubric. There are new additions, there are everything new. But when we are talking about mind, and there is a rubric in mind section, for example, anxiety from stomach. So if we have to give more emphasizing on stomach or anxiety, of course, we have to give more prominent, more emphasis on the anxiety, not on the stomach. So in this matter, second thing, you know that since Dr. Sagar started or adopted this idea of prescribing on the mental state of the patient, the first thing which started happening, uh, still, that I was asked that, doctor, why you people are more concerned or only limited to mental state? Why don't you add miasm? Why don't you add physical symptoms? It would be wonderful. You could do wonderful result if you add 4 physical symptoms with your mental idea. The result would be much better. And that started happening from 1986 onward. I mean, so friends, what happened? The first thing is appreciation. It is a very common factor, appreciation. In the beginning, it was not so appreciated. But for example, now I'm teaching today. Some of you appreciate it. So the appreciation is very easy to get, like homeopathy. Homeopathy is now the days getting appreciated all over the world, but its practical appreciation is very less. It means that still the people are not able to understand how homeopathy works, why it is slow, and due to that, whatever appreciation is there for homeopathy, it get diluted. So in the same manner, for example, I have been teaching for many years this method. Appreciation was there. Everybody was appreciating, wow, Dr. Saigal has done many things. But where was the failure? According to me, the failure was the appreciation to understanding, conversion of appreciation to understanding the whole concept, and from understanding to applicability. So the second part is understanding, and the third part is practical applicability. Most of those who have visited us or listened to me, they appreciated. Maybe they could not understand, and then they could not apply practically. Now, why I'm saying this? Because there are people who have been using this method entirely. But if I to say out of 100, there are few who are using this method entirely as per the Dr. Segal's concept exactly. And there are those who use it with physicals still. For example, they get natrum, so they think that what are the most physical, peculiar symptom of natrum if they have to prescribe on mental state, so they match it. Now, the question is that, is it not, it's not that I'm saying it's wrong, right or wrong. The question is, only using mental state and prescribing the medicine gives more quick result. And if the potency is same as we use only physical, only physical with mental symptom, but not mental state. What is the difference between the results? If the results are more better here and if the results are more better. So it was a debate for many years, and people were suggesting, I was getting suggestion from European countries that you will be more popular if you start using MISM with your idea. You will be more popular if you agree to follow, if you agree to add in your case physical also. And you say, okay, I have prescribed the medicine on the miasmatic basis plus physical plus mental. Then your appreciation will grow more. But there were few who were only appreciating Dr. Sagar's method, and they say, no, don't change. You should not change. Stick to your own idea and only do this, because otherwise you will spoil. In the book Dr. Sagar has written, in the book number 1 or 1A, Dr. Sagar has written about this idea. He wrote that I have got many suggestions that why not to use physical with the mind? What is the harm in it? Then Dr. Sagar wrote in the book that it is it will not give the same result. The result will vary, or it will spoil the result. It will spoil the management of the case. So we did not agree, and we stayed to the same one idea that okay, we will only use the mind, and we will not mix up with any other idea. So that is to be more clear. Those who want to use Segal or mind method, not Segal, forget about Segal word. Those who wanted to use mind method along with constitutional medicine, along with another physical generalities, modalities, they may ruin the case. They may ruin the outcome of the result. So that is the second thing. Now, the third part is that, as I told you, where we falter, where we make a mistake on the practical part. The practical part is a very heavy part. For example, there is always a question like potency. I've seen that many a times we are not talking about potency, which I'm going to talk today about it. And now the topic for me today is that how long that how long we can stay with one medicine for a one person. Like there was a idea which was populated that okay, I like to prescribe on mental state. Maybe they have not fully understand the concept. It was like I have heard few doctors, whenever, for example, they prescribe medicine on one set of symptoms, physical symptom or mental symptom, one set. Today they prescribe opium. They think there are three rubrics on one set of rubrics, and this is opium patient. Same patient is coming to them after 3 months or 4 months with different set of physical or mental symptom, then they think that they should take the present mental state according to that day. and that day the medicine is coming platinum. Then after 6 months, same patient is coming with different set of symptoms, entirely different from the first two, and then they take the mental state of that state because they think they have to take the present mental state. I don't know how many of you are using this concept that every time a patient is coming to you, you have to find a new medicine, or you continue with the same medicine which you have prescribed 6 months ago or 2 years ago. For example, you have prescribed a medicine to a patient 2 years ago and all his symptoms disappeared. After 2 years, he comes to you with an acute phase, like something acute happens. And he get a reminder that you have treated him 2 years ago and the result was fabulous. And he come back to you with a simple cold and cough or some minor problems. Now what to do? Because if you are going to take the same and something, you are taking a case of the patient or not, I don't know. But if you are now the state, you feel say, oh, today he's giving different kind of mind symptoms. And you forget what the medicine you have given 2 years ago. For example, 2 years ago, you have given belladonna. And today the patient is representing opium. And you think, okay, I give opium, but it doesn't work. Then you say, oh, maybe it's not opium, maybe it's stramonium today. And that why you are creating that image, because you forget why you given the medicine on the first time. Now, so I'm starting with a case now for you today. Let's study this case to make clear that how to persist with one medicine, even though the symptoms presented by the doctor are different. Every time, new set of physical symptoms. Okay, so we will listen this case first. I'm starting a case from 2016, and this time in 2023, with a different set of symptoms, he got the same medicine. Not only once, but several times. Okay, so let me start. Is a patient. Now, first the patient wrote me, since knowing you and your method of working, I always had the hope, the strong feeling that if I will get a really severe sickness in the future, I have the trier, the great luck of having you to help me or get me out of even from a long distance. You know, this patient is my student for many years now, but I think he thought that he should only use me when he really need me because of the distance. Always it is that you live so far, how could you help me? But this time when he's stuck, he asked me for help. The reason he had asked me for help is a bad repetition of cold and cough, which he was trying to heal by homeopathy. Now you can say this is a very simple cold and cough, bad repetition. So what is the case? But I have a feeling that I must talk with you because the sickness is coming back again and again. For I do not see a reliable change, a sure sign that I have passed the turning point of becoming permanent healthy again. Listen every word carefully because I did not hear the patient, I just read it on the WhatsApp. Permanently healthy again.
Hello, Yogesh. I'm asking for your help because since yesterday I have again a viral infection of the nose and the throat. I have yesterday during work coryza, and then when I got home in the evening, I had muscle pains and joint pains all over the body. and felt very weak. And all the symptoms became during the evening worse. I went to bed, and all the night I had a headache in the front of the face, and the nose were full of coryza, and the body was aching. I felt very sick again. So today in the morning I stayed at home. I cancelled the appointments with the patients because I cannot work in this condition. I was lying in the bed all the time.
So the patient narrated, and now I'm seeing myself in the same condition, slowly getting even deeper in health problem, trying to seek help, trying to alarm others about the bad thing that is inevitable coming, but with no reality. That means permanent solution. I'm having the same feeling which I had last time. That is change in mood between hope when there was some positive change and discouraged and desperate feeling when the disease struck back. So I gave the medicine only on the how last it was 2 minute 36 second 36 second of this video. He presented me with the some word that there's a headache, there are so many symptoms. So, and there was always a loss of hope, and he wanted to have a permanent. Why he contacted me? He contacted me because he wanted a permanent solution. And slowly, first he tried to help himself. So he wrote me permanent solution. So when we are talking, when the patient is saying something, we have to catch a word, particular word, why he's using this particular word in his case. And he was saying everybody that, so after the medicine, I gave him C6. The same day I felt in the afternoon a bit more energetic and could do some household work. The disease became gradually less, and I had the confidence again that I can overcome in a few days, which come true. I stayed at home on January 28 and went to work again on 29th. It was not the body symptoms that became better, but more the inner feeling that something has changed and that I will better again. The flu symptoms are 10% only now and are becoming less. See, first thing is that I chose the potency C6. I'm thankful to you and Segal method. After a few days, 2 days again follow.
Hello, Yogesh. Yes, of course, I can explain how I felt. I have the feeling that after taking it, things began to move in the right direction, as if a knot is opened up, and I felt that there will be no further complications and no further problems, because the symptoms became less, and I felt more energetic. And of course, I didn't have any fear or any doubts that the disease will proceed and become worse and turned out to be more difficult to treat or more dangerous for my health. Yes, this was the most important thing. Less doubt and fear that it would be a bigger problem, and more confidence and more easy feeling that things are moving in the right direction towards health. Yes, that's it. Bye-bye.
So the good sign after the remedy treatment with other remedies in the past, what is the difference? Even after recovering from the infection symptom, so this patient was using self-medication homeopathically. After using many homeopathic medicine, he contacted me and I gave this medicine. Now, what is the difference? In the past, what he was doing, for every problem, he was using different medicines. Okay. And from every different medicine, he would recover. But same thing. He passed even after recovering from the infection symptom. I still had same pain inside the head when coughing or stooping. This remaining symptom is now gone after taking the remedy. It means that when a patient is, or when you are giving every time different medicine to a patient, you are removing the symptom, but not the entire health is coming back. Is not regaining the health. Other important thing is, before taking this medicine, I was prone to catch infection easily. In case there is somebody in the family has flu or cold, few days ago, my two daughters have suffered from severe cold, but this time I did not get the infection. So that prevented the infection later on, he wrote me. That was a follow-up. So that one part, this is the one part I finished. Now, what happened? This patient contacted, this was 2016. Then this patient contacted me again in 2018, November 2018, after exactly 2 years. And then what happened? So I'm going now a bit faster because I have to clear the things. Now, first I tell you the medicine which I have given to this patient on the rubrics. Okay, so I use the rubric torpor for this patient because he was struggling with energy, no power. And then I use the rubric, second rubric, business neglect his. He is a practitioner, so whenever I'm in that time, he has no power. He neglected his business. He was not going to see the patient and cancel all the appointments. Embarrassment after ailments, because it is now here. What is embarrassment after ailment? Because every time he was trying to help himself, the problem was coming again and again. So what is embarrassment after ailment? That he was thinking that, oh, with this medicine, I'm completely okay. But after a few days, the same symptom reappear. And that was more embarrassing because this rubric, how we use this rubric in our clinic. For example, a patient is coming to you, the same patient, and he say, doctor, you know that when you give me medicine, I feel better. After a few days, same symptom reappear. Then I come back to you, and then you give me the medicine. Then I feel better. After a few days, same problems reappear, or maybe more than that. And now it's like coming back to you again and again and telling the same symptom is very embarrassing for the patient. Embarrassment is that why I'm not getting better. So what are the points for embarrassment the patient uses? Why I don't understand why I'm getting problem again and again. I don't understand that why only me suffering like this. I don't understand why everyone, when everyone can have things, whatever they like, why not me? I don't understand that when I will get better or get rid of this problem permanently. So those patients who use the word permanent solution. So when they visit a homeopath, most of the patients they visit a homeopath for a permanent solution. So why the permanent solution? Because they say the doctor is a everyday disturbance in my life. So every day in the morning I get up, end up having same problem. Next morning same problem. Then I take something, I get better for few days. Then again the same problem. It is so disturbing. If a patient use the word permanent solution because it is a disturbance in my life, then we can use the medicine gelsemium. So just I'm giving you one clue that how to differentiate between the medicines. Anguish with oppression. Oppression means the patient feels that the problem is trying to dominate, and this rubric is coming from nerve repertory. Cause to suffer. So every this patient is more feeling embarrassed, like opium is here. They feel more embarrassed because they feel that the problem is trying to dominate them, and they are not. The problem is not allowing them to come out of this crisis, everyday crisis. Anxiety if the fear of the fright remains. So the patient, even if the patient gets better, we use this rubric also from the nerve. Kant has not used this rubric. So that's why I say recommended last time also to have nerve repertory because it's most of the rubric we are using from the nerve. How we understand this rubric? Because I see that there are many seminars where you can have quick cases with few rubrics, but no explanation about the rubric according to the case, where they fit exactly. Now, in this case, there are three words we have to understand. How to understand the repertory. Anxiety, number one word, fright, number two word, and fear. This rubric contains three words which we have to differentiate first. What is the difference between fear and fright? That is the first thing. What is the difference between fear and anxiety? If the patient is using three words exactly in the same, from where I took this rubric, anxiety, fright remains if the fear of the anxiety. It means that it is a club of three rubrics. Three words, they are clubbed together. Now, what happens? For example, a patient got recovered. After a long time, he got recovery and he start feeling better. And that he said, Doctor, I'm very thankful that for the last 3 years, I was suffering from this problem. And luckily I met you and you gave me a very good medicine that I got better. So what happened that one day this patient start to suffer, feel a little bit symptom. So first thing is that anxiety, fright, and fear. So there are three things we have to clarify and remains. Now, first thing is that how this they relate to each other. So this patient start feeling good, very happy because after a long time he got a doctor and a medicine due to which he got recovered. Now he is living happily. One day it happens that his feel one of the indication of the same problem from which he has recovered after a very after a long phase, after a long torture. So embarrassment word is like a torture word. So embarrassment is like a torture. And he got recovered. And one of the very minute indication from the old disease appear. And immediately he gets alert. because in opium we have alert rubric also. He gets alert, oh, maybe the problem will come back again. And now he make the whole picture around that one particular small symptom. He make the whole picture. Oh, if that will come out, I will suffer like the same torture. And then what I will do? How will I survive? What will happen? Now it means that altogether he create a picture, and that picture remain in his mind till he comes to the doctor, or till so remain means that it has never gone out of his mind. Okay, for time being, when he was better, it was over. The moment he start feeling a little bit symptom, the same thing reappeared in his mind, and he start thinking that what if he'll go back to the same state. And it was so torturous, it was so tough for him to come out of the situation. So what he will do now? Anxiety. What he will do? What would happen again? So what is anxiety? In anxiety, please understand, those who doesn't understand, the patient will use the word what would. The would word, when a patient is using the word would, it means it is anxiety. Okay? Not for the fear. For the fear, he will never use the word would. So when a patient says what would happen, then you understand he's talking about anxiety. And if the patient says that I have, what is the fear? In fear, you never had this, you never know if the situation will come same like that. But it's like a fear is like for the future. You are predicting something which may happen like that. And what is fright? Fright is coming from the past experience. So fear is future, fright is past, anxiety means what would happen. So it means that the patient is thinking about that what would happen to him if that situation will come back, which was so torturous, how he is going to face it again. Maybe you understand. Anxiety, what would happen if the same situation come back, which was so torturous in the future, how he's going to handle it. So this is the same situation of an opium patient. Discourage alternating with hope. Now, this patient told me that whenever, okay, after taking medicine, something got better. Oh, okay, now this problem will not, now I will not face the problem again. But this hope goes away because some symptoms reappear or the same problem reappear, then he goes into the phase of discouraged. Now, what is the meaning of discouraged? The word is coming from courage. Discourage means that no courage left to start the treatment again. Sometimes the patient will come to you and say, doctor, I was so good, and I was hopeful that now this time this problem will not happen. But this problem, when comes back, I lose the hope. And I say, okay, I will not going to start the treatment again in my life. I will not go to the doctor. This word is discourage. Discourage and morose, will loss of, fear of extravagance. So opium 6 was given to this patient. Okay. Now what happened? That phase was over. In 2018, patient asked my help for influenza. Again, the same thing, losing the hope that I come out of it soon. Okay. Long torture of not getting well begins again. This time in 2018, he started again with the same thing. He did not contact me earlier. Same pattern. He took another medicine. Even he knew that he took opium, but he did not try himself opium again. He tried different medicine. When there is an improvement, I have hope that I soon recover. But when I get stuck, then I lose the hope. Same thing which he told me in 2016. I don't want to be sick all the time. This is embarrassment. I don't want to be sick all the time. I want to be alone, painful cough. Opium 30 was given with instant result, and then he got recovered. Now what happened? In 2019 March, patient again contacted me. Till now the patient told me that till now I was better due to good immune system. Again flu, and it is like a curse. Now a little thing he added that now I feel that this cold is like a curse and I can't avoid it. It will come back. I gave him opium 200. This time recovery was not full, so I gave opium 1M and then he got recovered. And 11 March 2020, after 19, another. Now, new symptoms have appeared for skin problem. Now he contacted me for skin problem. From many days and no sign of improvement with his own effort. Same pattern again. I am concerned if something is serious that it may cause more health problem in the future, like spreading out on another skin. Now, what is this? What is this line he used? What is this line he used? Spreading out on other skin area. Extravagance, fear of extravagance reappeared. He only wrote me this, that now he think in future. Future is, I told you what is future? Fear. Spreading out. Spreading out means on other skin area, this is extravagance. It means that it will spread and go further. So new set of symptom with the skin only in after 1 year. Opium 10M was given. For first 2 days better, but not fully recover. I asked to wait. After few days report, skin problem started to get better day by day. No pain. And in this part, it's a skin problem. Earlier issues were better quickly. This time, the patient did not feel immediately better, but after slowly, the skin problem vanished. Then, in 2022, again he asked my help. I gave him 50M. Severe headache, intense restlessness, anxiety. I wonder how long this problem will bother me. Again, there is a opium indication here. How long? These two words are opium. How long? Whenever a patient uses this word, doctor, how long I have to take the medicine? How long is going to recover? How long it will take? Two words, how long, denotes to opium. Again, 50M was given in August 2022. So it was in April, he contacted me. And then in August 2022. Now, new set of symptoms. Left joint shoulder pain may be due to wrong posture. I try to improve. Again, the same line. I try to improve it myself. This is not going away from the last 6 years, 2016 to 2022. I had the hope. Always hope is there. And hope, the patient always has a hope which was converting into discouragement because of what was discouraged for him, that why he could not help himself. But I asked him very friendly, what is the harm? What is the harm if you contact me directly instead of you use me after the failure? He say, I want to learn. I fail to understand that I'm applying mind symptom, I'm applying your method, and on every time new symptom appears, I never think that the same medicine will help me. So I try to find out my own mental state, but I fail. Then I have to come back to you. So always there is so whenever he feels some improvement with his own medication, hope will come. But when the hope lasted not very long, and pains return and again, this is so when the pains return again and again, this line is embarrassment ailment, which makes me sad. This is embarrassment, which makes me sad and irritated. Irritability, pain during pain. What is the pain? Why he's not getting better by his own way? Every time it happens. I gave him opium CM. 3rd August 2000, improvement 25%, and by 31st August fully recovered. No another medication. Now, what happened again? This journey has not finished yet. In July 2023, after August 2022, I need your help. Same word, I need your help desperately. Since last Sunday, I have been in trouble. I cannot work. I stayed at home. You know that business neglect his. Same thing is happening again. Whenever he used to get sick, he has to stay at home. Always has to stay at home and cannot work. These are the predominance. Two predominating. What we are saying, present, predominating, and persisting. All those, I told you the journey from 7 years. 7 years this patient is contacting me. He asks my help later on. Always he tries his own medication from here and there, though he knows my way of treating. He knows I treat him very well, but I don't know why he doesn't contact me in the beginning. Today I visited a general practitioner and had a blood examination for Borrelia serology. For I had the idea it could be, he had some problem again appeared. I have an erythema on my leg, new symptoms for 2 weeks now, which is slightly growing, but I did not see any tick bites. So my possible diagnosis is very unsure. My problem began last Sunday, one day before I visited my sister, and we had dinner outside at a restaurant. Sunday morning, I woke up with nausea and abdominal pain, had light diarrhea, and felt sick. Also, during the day, I was tired, sleepy, and had no energy. I slept a little but planned to stay back home again. I was worried about the long driving home, but I decided to do it. Unfortunately, I had a flat tire, so I had to stay one more day with my sister. Monday, I had diarrhea, a little bit of high temperature, no appetite, pains in the muscles, and I felt tired again. See, always tired, always sleepy. What is the rubric? Torpor. Always, whenever he used to the extreme state, the torpor comes back. No desire for business, neglect business, all patterns same. Even those symptoms are changing. At that time, I thought I had some kind of food poisoning. For that reason, I took Okubaka D4, one dose on Tuesday morning. I'm not sure if you know what is Okubaka D4. Monday, I drove back home and had headache, felt tired and sleepy. It was very exhausting. When I get home late in the evening, I had stronger diarrhea. What is Okubaka? So I thought, let me understand what is Okubaka. It is frequently prescribed in Germany in low dilution to treat poisoning, whether from food, chemical, or drugs. The bark of this tree is traditionally used in Africa to combat tummy upset with poisoning, tendency alternating with discouragement and allergic rhinitis. Tendency alternating with discouragement. Even in Okubaka, he used, but it was not a similimum. It was just for the symptom. Even that medicine has discouragement in this in their finding. Allergy rhinitis would have make one thing as much. Always also for rhinitis, influenza. The next 2 days there was rather a deterioration. I had a stronger headache. It feels like migraine and pain in my neck, back and legs. During the last 2 nights, I could not easily really sleep because of the pain in my legs. I cannot find a position. I'm tossing about in bed with calm. The pain in the without calm. The pain in the legs feel like neuralgia and are very intense during the night and persist also during the day. I know such pain from other viral infections in the past during the COVID sickness, but in the past they were not so severe and did not persist during the daytime. Therefore, I thought it could be acute borealis. Now here, so I feel seriously sick. Now why he contacted me? Because he started feeling seriously sick. I must stay home. I cannot work to earn money. Business neglect again. I don't really know what the hell this sickness is. And I am suffering a lot. Again, embarrassment. I don't really know what the hell this sickness is, grouping in the dark, and cannot get at least any rest because I cannot sleep. It is like a torture. And what is this word? It is like torture, embarrassment, and cannot find a way because torture is a mental state, not a physical state. On the one side, I want to stop this definitely. And on the other side, I'm afraid it could be some dangerous and harmful disease which can cause permanent damage in my body. Can you please help me? Opium 6 was given. Opium CM was given August 22. 6, opium 6. What is the result? After 2 days, dear Yogesh, I took opium, on 6. On Wednesday evening, the pain in the head and legs improved a lot. The last 2 nights, I could sleep much better. The pain have gone again away. I feel well again. I could work. Yesterday and today, if I get no relapse in the next future, I would say I'm fine again. Today I got the result. Nothing was there. Thank you very much. Once again, I was amazed. Torpor was the same rubric which I use always for this patient. Always using the same rubric torpor, same rubric business neglect his every time he used to get sick, embarrassment, ailment every time. And every time he was getting better by opium. By next potency, I never repeated the same potency again. But I was using opium from 2016. And 2016, he presented me with different diseases, different symptoms. But what I was listening, his common version. In his common version, he was again giving me the indication that he's still opium patient. Now, this is not the first case. There are plenty of cases which I'm giving same medicine for last 15 years, last 16 years. Patient is getting only one medicine after 3 years, even if he's coming with different set of symptoms entirely. So, friend, the difference is that what is the idea of this case is that symptoms can change. Mental state of the patient remains the same, which you find as a similimum first time. So, what is the indication that the medicine is similimum? Even if the symptom change and you give the same medicine, that set of symptom has to be removed by the same similimum. Then you understand this is a similimum, not the right medicine. What is happening in this? Why I chose this topic? Those who are learning Segal method, probably they could not understand. We don't have to change the medicine on every set of symptom and find a new mind symptoms. There are new mind symptoms. There are new physical symptoms. But the patient mental state, if it is a similimum, so what is the difference between mind symptom and mental state? I was telling again and again many times all my seminar. Mind symptoms are just anxiety, fear, fright. They are the symptoms. But what is the state of the patient? Not to ask help, to stay at home. This is illness. This is illness. When a patient is willing to stay at home, when a patient say, I'm not able to eat, when a patient say, I'm not able to move, when a patient say, I'm losing the hope again, these are the illnesses. These are when a patient says, I want to stay in bed, I'm not using the rubric bed desire to remain in. And I'm not concerned about earning the money. Then I use the rubric business neglect instead of bed desire to remain in. You're not focusing on the words of the patient, but you are still focusing on the symptoms of the patient, symptoms of illness, symptom of disease, which we should not take. We have to focus on what the patient says about his disease rather than his symptoms. Are you getting my point? So this case, I want to tell you, please, once you decode the mental state of the patient, don't change the medicine and don't repeat the same potency again in the same pattern. Only go in a circle, 6, 30, 200, and 6 again, 30, 200, like this. And it helps the patient. And the possibility is that whenever so you don't have to find new remedy every time a patient is coming with a different set of symptoms. Stay with the same medicine which you have given him 3 years ago. And it will confirm you that the first medicine which you was given was not hit and trial. The first medicine which you have given was a similimum chosen by you, but you have to keep confidence in yourself. Sometimes we don't have a confidence and we prescribe different medicines to the patient. Even at home, you will see that in our own family members, we are not able to treat because when they come to us, they represent a new symptom. We give a new mental state and we give the new medicine to them and they struggle for 10 years. Even the doctors, what is the most embarrassing for the doctor homeopath who are coming to me? One thing they tell that doctor, what is more embarrassing for me, I have treated so many cases who are like me, but I could not find remedy for myself. I have treated A, B, C, D diseases in many cases. Wonderful result. But why it is that when I prescribe medicine to myself, I never get the result? I'm struggling for 6 years. I have taken 100 medicine, but I could not reach to the symptom of myself. And this is same embarrassment for the patient. They say, doctor, I have seen so many cases like me who got treated by homeopathy successfully. But in my case, homeopathy is not working. What is this? So the patients are confused because the last point which I'm going to mention today, there is still a very big confusion is created in the market whether individuality is more important than the nature of the patient. So some people are guiding that no, nature of the patient is very important in understanding the mental state of the patient, not the individuality is important. And somebody is using that word, somebody is using that word, but this is not true. Nature, personality, and individuality. There are three words: nature, personality, and individuality. We have to be very careful that we should not mix personality with the individuality. What is the personality of a patient? Dress, makeup. When a patient is coming to you with a makeup, okay, a lady is coming to you, and you know the way she's talking, the way she comes with the dress up, this is her personality. This is not her individuality. The individuality is that how a patient present himself according to the present symptoms he is facing. We have to understand the patient feeling on the present symptom he is suffering from, not the personality. And what is the nature? There is again a confusion has been created in the market that we have to take the nature of the patient. But which nature you have to take? If you really understand what is the nature and difference between nature and individuality, the nature can vary. We have to understand during the sick state, the feeling of the patient rather than the nature of the patient. Feeling is more important. Nature is not important. Because from the nature, see, there are four people around you. Everyone tells differently about you because everybody perceives your nature differently. They say, oh, according to me, his nature is doctor. That nature means natural. That whenever I think that he's a very irritated, this is nature. His nature is that he gets irritated very easily. This is perceived. This is how they perceive a people by nature. This is not true. Now, individuality you only can clarify from the patient itself. See, I asked the patient, your mother, your family is telling you that you often get irritated. They say, doctor, by nature, he's a very sad person. By nature, he gets irritated very easily. Maybe they don't understand the word nature by themselves. So I asked the patient that if you clarify me why your family member have this opinion about you that you get irritated very easily, they tell me that you get sad very easily. Is it true? Sometimes the patient says, no, it's not true. Doctor, if I'm not well, it's obvious that I will get sad. It's not my nature. I'm not always sad. It is only when I'm sick, I represent my feeling in a sadness that I'm not happy. And they think that I'm always saying like this. So nature means a person is behaving the same pattern. And what people are have impression of that nature, that doctor, I know by nature my child is very calm. By nature, my child is very calm. But during the sickness, he is different. So here the nature will not help you. Personality will not help you. Individuality will help you. Please, okay? So, friend, this is the one of the situation. Please stick to the mental state. Please stick to the same medicine as I told you from 2016 to 2023. Yes, we have to finish this seminar now, Dr. Dinesh Kumarji. Next time, I will tell you more about individuality and personality and nature. It means that still people are in doubt. So it's good to know that people are in doubt, and I will clear this doubt in the future seminars. So one by one, I'm taking a topic now. My idea has changed now. I'm not going to take cases, quick rubrics, finish the matter. Now I will not do this. What I do now, I will go step by step. I will take one case and fully describe the case, a long case, like 7 years, a case which is with me for long time, 7 years, 8 years, 10 years. What I did in that case, how I handled that case, is because sometimes what happens, we tell short cases, a good result, but what happens in between, we don't know how long this medicine will be remain effective. So I think that you must have learned to stick with one medicine even for 7 years. I have more cases where I will tell you. Thank you very much. Have a nice day. Stay calm and learn more. Bye-bye.
Thank you, sir. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you so much, sir.
Thank you, sir.
Thank you, sir.
Master.
Thank you, sir.
Thank you, sir. Thank you so much.
Thank you so much, sir. Thank you, sir. Wonderful learning.
Thank you, sir.
Okay,
Thank
so
you,
you can
sir,
you
for
can
the
send your
wonderful session.
you can send what
Thank
you
you,
like
sir.
it more, and if you like more in future classes, what do you want? Please let me know.
Thanks
Okay?
a lot, sir. It was a
Bye.
great enlightenment today. So thankful to you. Really, it helped a
See,
lot to clear
this
many
Thank you,
doubts.
sir. Thank you very much.
see this light was already shown by Dr. Sehgal, but I think we were not in touch with him directly or indirectly. So that's why my idea is to bring his idea forward and to show you how I implement it. So my implementation may be different than your implementation, but don't worry, you will learn. Sooner or later,
We
I
are
will take
learning
you.
basics now. We are learning basics now. Thanks
You
a
have
lot.
to. You have to. Okay, bye.
Okay, bye.